And greetings, Patrick Wood here for Technocracy News and Trends, and welcome to all of you English speakers around the world. I'm not sure what you say to an international audience, but I know there are many people in many countries that speak English outside of, for instance, Canada and America and Great Britain. So I might say hello, Earthlings, but I'm glad that people are coming from all over the planet to read technocracy.news. This is encouraging on so many fronts that people around the world are starting to get the idea that there really is something to technocracy. Maybe they heard about it before and they poo-pooed it and said, I don't think so. But now that things are progressing with this pandemic and the great panic of 2020, many people are starting to pay attention, and they're starting to get the idea that, yes, there's another group of bad actors in the world, not just the communists, not just the Marxists, not just the socialists, but technocrats intending to engineer a technocracy-oriented, resource-based economic system on the planet. You can call it whatever you want: sustainable development. You can call it green economy. You can call it Green New Deal. You can call it natural capitalism. But most appropriately, you can call it technocracy because it's been around for a very long time, since the 1930s, as a matter of fact. I've documented that thoroughly in my books, and I hope that you can get a hold of either Technocracy, The Hard Road to World Order. I think I'd read that one first if I were you. That's the latest book. And then go back and read Technocracy Rising, the Trojan Horse of Global Transformation. And if you can't sense it yet, the world is in a crucible of change. If you've ever seen a pharmacist use a crucible, it's a little granite base with like a club that grinds the pills into powder inside the crucible. That's what's happening in the world today. We're undergoing the most massive change in the economic system of the planet that we've probably experienced in history, even greater than the time during the Great Depression. And the Great Depression, indeed, was really just a failure, a temporary failure of capitalism to be able to support itself, but it never became something else along the way. Even though technocrats back then wanted it to, the economic system was not transformed back then, but it is today. We see it all around the planet, and the fact that people are coming from all around the planet to understand technocracy only tells me that it's global in nature. It's not just local. So having said that, we're going to take a look at a story that's just absolutely dominating technocracy.news these days, and that is the story that comes to us from Dr. Russell Blaylock. He happens to be a friend of mine, and I'm pleased to have known him for many years now and followed his work. Of course, his detractors don't like him very much, but if you understand what he writes about, namely big pharma, vaccines, etc., you can see why people want to take shots at him. And I don't mean vaccine shots. Dr. Blaylock has been on the forefront of brain health for so many years. He's a board-certified neurosurgeon. And I love to tell people when they ask me, well, what are you, a brain surgeon or something? I say, no, but I have a friend who is, and this is what he says. And yeah, it gets them to be quiet real quick, doesn't it? Well, I encourage you to go to technocracy.news and read this story. And you'll notice I've displayed it on the screen here that there is a please share this story at the bottom. And I would encourage you to share it on any social media platform that you happen to be on. That would be, of course, Twitter and Facebook. LinkedIn is a big one now. MeWe also is supported here. I know many of you are on MeWe, and you can click that link in the middle and share there, and you can also share via email. It's very easy to share. Just click one button and it'll do it. This story was posted yesterday morning. It has since gone absolutely viral. You never know with any social media platform what is going to go viral and what's not. Sometimes there's just no rhyme nor reason. You can't figure out what happened. But in this case, it's gone viral. The story, in just a matter of 24 hours, has received over 65,000 views from around the world. About 55 to 60% of those views, by the way, have been from America. The rest of them are overseas. This apparently has caught the attention of a lot of people who feel the same way. What's wrong with wearing face masks? During the lengthy part of the so-called lockdown, I call it the Great Panic of 2020, during that period of time, there was very little requirement for people to wear face masks, for instance, on the street or during the normal course of business when they go out to stores and so on, unless you're sick. If you're sick, they recommended that you wear something if you have to go out, like to a doctor's office. That always makes sense. If you know you're sick, you don't want to go out and cough on a lot of people and get them sick. That's just rude. But we're not talking about that. We're talking about healthy people. There was no big requirement during the major portion of the lockdown to wear a face mask. Now that we're coming out of the lockdown around the world, all of a sudden, there's these requirements popping up that everybody has to wear a face mask. This is absolutely incredible considering it wasn't required before, but now it is. So the question comes up immediately. You see stores like Costco, and I heard now Walmart is on the bandwagon too, where you can't shop there unless you wear a face mask. They won't let you into the store. Already, Costco shoppers are demanding a refund for their membership. Say, we're not coming back here until you drop that criteria. And there will be other big box stores and other little stores that kind of follow along with them. A lot of it is fear. There is no government mandate whatsoever requiring you to wear a face mask if you're healthy. But a store like Costco can do whatever they want. It's like their user policies. They can say, you can't get in here unless you're wearing a shirt or shoes. In this case, it's a face mask. Only consumers can settle that one for Costco and these other stores that demand it. But in the meantime, what's the evidence that face masks for the healthy are risky to your health? This is the question du jour. Personally, I will not wear a face mask, period. There are certain exceptions to that, perhaps. If I go to a doctor's office and I'm sick, I'll wear a face mask. If I go into a hospital where I know there's all kinds of infections floating around and other stuff happening, and the doctor or the nurse says, we'd like you to put on a face mask and a gown to go in and visit your friend or your family member, I'd wear a face mask. But I'm not going to wear one on the street for 6 to 8 hours straight. And if I was employed by a company like Costco, and they demanded as an employee that I wear a face mask for my entire 8-hour shift, I would have a problem working there. And a lot of people are right now because they're starting to realize something's wrong with this face mask business. So I asked my friend, Dr. Russell Blaylock, to write this article for Technocracy News, figuring, well, somebody's got to say it, somebody's got to lay it out with some authority. I don't have such authority. I'm not a doctor. I'm not medically trained. The closest I ever got to any medical training was when I was in the Medic Corps in the National Guard a long time ago. And believe me, there was no medical training that was given me at that point. So I'm just a person just like you, using a little bit of common sense. You don't need to be a rocket scientist, literally, to figure out that there's some health risk when you wear a face mask. In fact, many people have already reported to me through the comment section on Technocracy News that, wow, they wore a face mask for a little time. They started getting headaches. They started getting fatigued. They just had, problems that they knew were associated with wearing the face mask. So Dr. Blaylock's article is seminal, apparently. It's being voted up, if you will, by the world right now, and I encourage you to get involved with it and pass it around. I wrote at the top of this article, Dr. Russell Blaylock warns that not only do face masks fail to protect the healthy from getting sick, but they also create serious health risks to the wearer. The bottom line is that if you are not sick, you should not wear a face mask. I can just hear the flack coming from people on the other side of this issue right now. But hey, it's your right to understand what the risks are. If you want to wear a face mask 24 hours a day, that's your privilege. That's your right. This is America, for Pete's sake. This is not communist China. You can do whatever you want. But you should understand the risks. That's all we're saying here. So before you attack me for having put this out or attack Dr. Blaylock or whatever, the intent of this is simply to describe and delineate the risks to you so you can make an informed decision. And if you say, no, I don't buy that, I'm going to wear a mask. Okay, go wear a mask. That's your life. It's your health. It's your choice. You can do it. So I said, as businesses reopen, many are requiring shoppers and employees to wear a face mask. Costco, for instance, will not allow shoppers into the store without wearing a face mask. Many employers are requiring all employees to wear a face mask while at work. And in some jurisdictions, all citizens must wear a face mask if they are outside of their own home. And in that case, these are local ordinances that are being passed by city councils or county officials. They are not from the federal government. There is not a federal mandate that everybody should wear or must wear a face mask while they're out on the street. So Dr. Blaylock writes, with the advent of the so-called COVID-19 pandemic, we have seen a number of medical practices that have little or no scientific support as regards reducing the spread of this infection. One of these measures is the wearing of facial masks, either a surgical type mask, bandana, or N95 respirator mask. When the pandemic began and we knew little about the virus itself or its epidemiologic behavior, it was assumed that it would behave in terms of spread among communities like other respiratory viruses. Little has presented itself after intense study of this virus and its behavior to change this perception. This is somewhat of an unusual virus in that for the vast majority of people infected by the virus, one experiences either no illness, that is, they're asymptomatic, or very little sickness. Only a very small number of people are at risk of a potentially serious outcome from the infection, mainly those with underlying serious medical conditions in conjunction with advanced age and frailty, those with immune compromising conditions, and nursing home patients near the end of their lives. There is growing evidence that the treatment protocol issued to treating doctors by the CDC, mainly intubation and the use of a ventilator, that is a respirator, may have contributed significantly to the high death rate in these select individuals. Let me pause just for a second and talk about protocols. 20 years ago, medicine and the practice of medicine was left up to your physician. It was their training and their choice on how to treat you based on their relationship with you. They know you. They interact with you. They talk to you. They examine you. They look at your family situation and the people around you as they decide how to treat you for a particular condition that you might have. This was a wonderful thing originally on how medicine was practiced, and there's just a core of dedicated medical professionals like that realize that the whole practice of medicine is based on relationship, how they know you and how you know them, and a trust builds between a doctor and his patient. That would be you. Now, fast forward 20 years to today, where medicine has been taken over by the large companies, big pharma included, who have restructured the practice of medicine to be a top-down, what they call information or driven or evidence-based medicine, where these protocols are set up at the top of the chain and then passed down to doctors on how doctors will treat a given condition. These protocols do not originate with your physician. They originate somewhere high up in the hierarchy of the health maintenance organization or an insurance company or big pharma or wherever on how certain diseases or certain conditions should be treated. And those protocols today are simply passed down to the doctors, the surgeons, and the people in the healthcare system and said, when somebody presents themselves with these symptoms, this is what you must do. There was no choice. You just do it, or else you may not get paid by Medicare or whoever insurance company was ever paying it. If you don't follow these protocols, we may not just pay you. Or we may do even worse and throw you out of your HMO and say you can't practice here anymore because you're not following the protocols, you see. Now, there are organizations, health freedom organizations around America, who describe this process very well. It's transformed medicine and the practice of medicine from a true medicine, if you will, into this something other than true medicine, where evidence-based protocols are passed down from on high, and you will take that whether you want it or not. Now, this is how so many people have gotten on respirators, ventilators, that have resulted in many deaths around the country. In fact, this is exactly what Dr. Blaylock is alluding to here when he says treatment protocol issued to treating doctors. This is exactly what I just explained. And so these doctors and emergency personnel are not acting according to their own good judgment. They're simply going down the checklist and saying, okay, bring out the ventilator. It's time for, this drug or that drug or whatever. And they're simply following the orders from above. And I will tell you, this is very frustrating for most doctors and nurses, especially those who have been around for a while, like 20, 25 years, and know what real medicine is. They're very frustrated. That's why many of them just left the industry. They've quit. Some of them have gotten fired. A lot of doctors are going to a cash-only practice. They're saying, we're not going to even participate with this anymore. We'll go down and hang up our shingle and say $50 to come see me, and I don't answer to anybody. If you like that kind of idea, you probably could find some cash-only doctors or practices in your local town. And if you haven't, go encourage somebody to do it, because it means you'll actually get the straight scoop from a real doctor who is practicing the medicine he was trained to in the first place. So let's read on here. As for the scientific support for the use of face masks, a recent careful examination of the literature, which he did, in which 17 of the best studies were analyzed, concluded that, quote, none of the studies established a conclusive relationship between mask or respirator use and protection against influenza infection. Keep in mind, no studies have been done to demonstrate that either a cloth mask or an N95 mask has any effect on the transmission of the COVID-19 virus. Any recommendations, therefore, have to be based on studies of influenza virus transmission, and as you have seen, there is no conclusive evidence of their efficiency in controlling flu virus transmission. It is also instructive to know that until recently, the CDC did not recommend wearing a face mask or covering of any kind unless a person was known to be infected. That is, until recently. Non-infected people need not wear a mask. When a person has TB, we have them wear a mask. And I want to say, yeah, duh, of course so. Not the entire community of the non-infected. The recommendations by the CDC and the WHO are not based on any studies of this virus and have never been used to contain any other virus pandemic or epidemic in history. Now that we've established that there's no scientific evidence necessitating the wearing of a face mask for prevention, are there dangers to wearing a face mask, especially for long periods? Several studies have indeed found significant problems with wearing such a mask. This can vary from headaches to increased airway resistance, carbon dioxide accumulation, to hypoxia, all the way to serious life-threatening complications. There is a difference between the N95 respirator mask and the surgical mask, that's the one that's cloth or paper, in terms of side effects. The N95 mask, which filters out 95% of particles with a median diameter of greater than 0.3 um squared, because it impairs respiratory exchange, that is breathing, to a greater degree than a soft mask, and is more often associated with headaches. In one such study, researchers surveyed 212 healthcare workers, 45 males and 165 females, asking about the presence of headaches with the N95 mask use, duration of the headache, type of headaches, and if the person had pre-existing headaches. They found that a third of the workers developed headaches with the use of the mask. Most had pre-existing headaches that were worsened by the mask wearing, and 60% required pain medications for relief. As to the cause of the headaches, while straps and pressure from the mask could be causative, the bulk of the evidence points toward hypoxia and or hypercapnia as the cause. That is, a reduction in blood oxygenation or the elevation of blood CO2. It is known that the N95 mask, if worn for hours, can reduce blood oxygenation as much as 20%, which can lead to a loss of consciousness, as happened to the hapless fellow driving around alone in his car wearing the N95 mask, causing him to pass out and to crash his car and sustain injuries. This just happened. I am sure that we have several cases of elderly individuals or any person with poor lung function passing out, hitting their head. This, of course, can lead to death. A more recent study involving 159 healthcare workers aged 21 to 35 years of age found that 81% developed headaches from wearing a face mask. Some had pre-existing headaches that were precipitated by the mask. All felt like headaches affected their work performance. Well, of course, that would. Unfortunately, no one is telling the frail elderly and those with lung diseases such as COPD, emphysema, or pulmonary fibrosis of the dangers when wearing a face mask of any kind, which can cause a severe worsening of lung function. This also includes lung cancer patients and people having had lung surgery, especially with partial resection or even the removal of a whole lung. This article goes on. I'm going to cut short reading it because I want you to go there to the website, technocracy.news, and read this article in full yourself. Even print it just in case it disappears from the internet, because it tells it like it is from a legitimate practicing doctor who doesn't answer to anybody today, by the way. He doesn't have to worry about anybody giving him protocols. He's beyond it because he is retired from active surgery. But during his career, he had operation experience on countless numbers of people. He is a neurosurgeon after all, board certified. He knows what he's talking about. The thing in my discussion with him, and it's mentioned briefly in this article, is that when you breathe in through a mask, All the stuff that your body wants to exhaust is trapped on the inside of the mask. There's a reason your body wants to get rid of certain things. So your lungs is a system that acts kind of like the exhaust on your car. The bad stuff goes out and you breathe in the good, fresh air. And that goes into your lungs and it helps to clean it out. You get oxygen, you get energy from it. But listen, when you breathe the exhaust into a mask and it stays there, what happens now when you rebreathe, you're taking all of that stuff back into your lungs again and actually enriching the concentration of viruses in your lung. This is just common sense. This doesn't need a medical study to figure this out. This is obvious. But Dr. Blaylock pointed out to me, when you breathe out of your mouth, normally, you breathe out from your nose too, but normally as you breathe out, it's a one-way trip for all of that stuff. When you're breathing back in the mask, and you're breathing in through your nose especially, this concentration of stuff you just got rid of is going back into your nose, into your sinus cavities, and offers a pathway to get into your brain. This is not normally part of the cycle that these things would be present in your brain. But he said, as a neurosurgeon, there are great risks involved with this and taking some of these virus particles and stuff, and not just COVID-19, could be anything, but taking those things back into your nose can be extremely dangerous. And that's one of the big risks of wearing a face mask if you're healthy. You might find that you're not healthy very long. And it has nothing to do with COVID necessarily, but it could be some other virus. It could be some other thing that your body wants to get rid of, that it needs to get rid of. You don't want those things in your nose cavities where they could potentially penetrate your brain. Well, this is a very serious topic. And all I can say is I want you to read for yourself what they say. Make your own choice. If you want to wear a face mask, that's absolutely your choice on any given occasion. If you don't mind wearing a face mask going into Costco for, 20-minute shopping trip, fine, go do it. You're probably not going to drop dead because you wear a face mask for 20 minutes. But here's the point. Everybody is scared to death right now about this whole virus thing, and they're just knuckling under to this whole concept. Well, if you don't wear a face mask, why, you are a selfish bum, or worse. I've heard a lot of curse words used. You are a selfish bum, and you don't think about anybody but yourself. This kind of nonsense just has to stop. This thinking has to stop. Only citizens like you and I will have a shot at it. And I'll tell you what, we need to calm these people down and bring them off of the hostage situation where they're holding themselves and everybody else hostage to this whole mantra. One of my friends and the trainer that I've actually featured on Technocracy News before, Mary Baker, likens this whole thing to an act, to a stage play where everybody is given a role to play. Citizens have their role, companies have their role, doctors have their role. You get the idea. Everybody's got a role to play. She says, when it comes to face mask and health, your own health issues and stuff, don't play the role they give you. That just makes so much sense. Don't play the role they give you. Just politely refuse and say, no, I'm not going to play that role. I'm not going to fall into that trap. And I'm not going to give up my own health and maybe perhaps the health of my family because you say I should for the quote-unquote greater good. Well, that's probably enough of beating this one to death for today. I'm Patrick Wood for Technocracy News and Trends, and I do hope that you will take this next screen and take a minute to write it down where you can subscribe on YouTube. If you're hearing this on YouTube, You can go to Podbean, the Podbean account, which is technocracy.studio. You can follow me there, and you can also download their app, which is a very good app for Podbean that will automatically download episodes as they occur. And lastly, if you have not done so yet, join the mailing list at technocracy.news. You can keep abreast of everything that I post every day and all the podcasts as well, and you can keep up to date. Please share all of this information. The window is closing on social media, as you know. So please share when you can and let other people know. And if they give you a flack on it, just ignore it. Don't worry about it. They're people too. They have the right to their own opinion. But we have an opportunity to influence a lot of people during this great panic of 2020. We need to take advantage of this opportunity and educate as many people as we can to what's really going on. And this is one area where we can make a huge difference.